All right, it is 5 o'clock and I'm Dr. Mills. I am a chiropractor here in San Francisco. We'll be doing a headache Q&A live today on Instagram. My specialty is chiropractic, so we're gonna focus in on the types of headaches that chiropractors are really good at fixing, and that's called cervicogenic headache. Let's break that word down. Cervico, it just means neck in Latin. I don't know why we had to do that and name everything in Latin. It's kind of annoying, right? So from the neck, and genic just means genesis. It's the start of. So these are headaches that originate or start in the neck. So one of the big things we see with this is a couple of factors. Usually the pain arises from the neck and wraps up into the head, often into the back of the head. This is what we call a question mark referral pattern. So it goes like this and then up into oftentimes the back of the head or to the temporal region. So that kind of classic, doc, they come in and they say, I got these headaches. Well, where do they start? Well, I get a little bit of neck pain, kind of starts in the back of the skull and then wraps up to here. That's a real big indicator right off the bat that we might be dealing with a cervicogenic headache. The other word we use for this sometimes, and they're kind of grouped together, is suboccipital. Again, let's break that word down. Sub means under, and occiput is the back of the skull, so under the skull. And right at the back and base of that skull, we've got a group of muscles. And they can get tight, overactive, and there is a couple nerves that come out of that area. And so if those nerves are affected, you can get suboccipital, or again, under the skull, headache, or sometimes we'll call it suboccipital neuralgia, which is an irritation to that nerve. That can give you that same kind of pattern, sometimes exacerbated with movement. Sometimes we'll see it exacerbated with temperature changes. And so that is another big clue that we might be dealing with a headache that's arising from the neck. Other factors that go into suboccipital headaches or cervicogenic headaches is a past history of trauma, or the big one that I see a lot in my office, I'll try to demonstrate it here, is posture. So if I'm sitting at a desk and I go into this position, our natural righting reflex of the head and the eyes brings the head up into this position. And so if you see that position, you can see we're crowding that suboccipital space, and that's gonna potentially create some irritation in those nerves that come out of the back of the head. So let's talk about a couple of daily drills that I really like. The first one's gonna be chin tucks. So sitting up nice and tall, you can do this sitting, and we'll talk about a different variation as well. And all you're gonna do is talk and move through what's called translation. Let me see if I can get a little bit more to the side here. So translation is moving the head and neck forward and backward without tucking the chin up and down. We'll do those ones in a second. But translation is a movement that a lot of people are not able to do. So let me see if I can chin glide a few of these. So the idea is I'm thinking about if I had a finger, I just push that chin all the way back. So try that right now. If you're watching this, put your phone down for a second and just try 10 chin tucks or chin glides. You might realize really quickly, I can't do that. And that's because we've lost motor control in these deep neck flexors, which is really common. So that's a stability exercise. Let's talk about a couple mobility drills. Normal range of motion of the neck is 60 degrees of flexion, so being able to get the chin tucked down to the sternum. 50 degrees of extension, so getting the eyes almost parallel to the back. Lateral flexion, about 35 to 40 degrees there, both sides. And then rotation, being able to get the chin almost to the shoulder, both sides. Let's go a little bit deeper dive into a home drill. I call this occipital floss, and this is again a little bit more nuanced range of motion, but basically what I'm thinking about is if the occiput, or the base of the skull, is like a dome, and then the first vertebrae that it sits on is kind of like a cup, we want to rock that dome and cup like this position. And how we're going to do that is just by thinking about this space here and tucking the chin just a little bit. So we're going to pull the chin back and then we're going to flex it. It's hard for me to talk and do that at the same time, so let me just show it. Tuck and tuck. If you do that correctly, you should feel a little bit of glide and flexion right at the base of the skull. And most people, when they do this, will say, oh, it actually feels tight and it feels like it needs to be stretched. Last one, talking about posture and things you can do at home, it's just fixing that what's called upper cross syndrome, which is tight pecs and weak scapular stabilizers. So one of my favorite things to do is just teach people basically scapular retraction, pulling those shoulders back, Brugger's relief position if you're a desk worker, which is this position, rows versus, kind of crowding the chest. So activating those upper scapular retractors, bringing the back shoulder blades back together, try to get it away from that foreground shoulders. That will actually help create a stable base for the head and neck and help reduce problems long term. I am going to be signing off now, guys. If you have more questions and didn't get a chance to answer them, drop into my DMs. The DMs are open.